of non-deployability comes from musculoskeletal injuries, so obviously this is a big, important problem for the Army. One of the major problems that we have is low back injuries. Low back injuries are of a variety of types, but I would say some of the most common ones that are experienced is a lumbar strain, a herniated disc, or sciatica. All of these injuries are preventable and or treatable with common exercises. So today I'd like to focus on some of the exercises to both treat and prevent low back injury. To do these exercises, you will need very little equipment, mainly your own body weight and a mat for comfort. The first exercise involves laying flat on the mat and bringing your knee up to your chest while keeping the other leg extended. Pull your knee as close to your chest as possible and hold there for at least 10 seconds. Switch knees. And hold. This exercise will stretch the lower back and also opens up the hip area for issues related to sciatica. The second exercise, you'll want to keep your knees bent and then let them both move together in one unit over to one side. You can then lay your arms out to the sides while keeping your legs onto the ground. Hold this for at least 10 seconds. And then you want to bring your knees back up to the center and then bring your knees down to the other side. This is a good stretch both for the lower back and for sciatica. And then bring your knees back up to the center. The next exercise can be done in several ways, but laying down, this exercise involves putting your ankle onto your knee and letting your knee move out to the side. You will then either reach down to grab your thigh or your shin and bring this closer to your body. This again will open up your hip and stretch especially the sciatic nerve. So that can be done like this or like this. And you want to switch sides, obviously. Bringing the knee out to the side, reach down, pull the leg or the shin towards you. And then relax. Exercise can actually be done sitting in a chair. The exercise to work your sciatic nerve can also be done in a sitting position by bringing your ankle up to your knee and then pressing down using both hands and leaning forward. This is a simple exercise that you can do while sitting at your office chair to consistently keep that sciatic nerve area open. And then you can do this on the other side by putting your ankle onto your knee, pressing your one hand down on your knee and putting your other hand on your ankle, and then just leaning forward. Very simple exercises that you can do to strengthen or to stretch your lower back and sciatic nerve area. The next area that I'd like to focus on for the low back is actually the abdominal musculature, because if you have strong abdominal muscles and strong back muscles, you're much less likely to bend over to pick up a sock and throw out your back. So we'd like to focus on strengthening the abdominal muscles. One of the easiest exercises that you can do to strengthen your abdominal muscles is a simple plank. This can be done forearm or full extended arm plank, but I'm going to just demonstrate the forearm plank. So you'll start with your arms in a 90-degree position and your legs extended. Then you just bring your legs up and hold. Hold for as long as possible. 30 to 60 seconds would be optimal to hold in this position. This is an excellent exercise to strengthen your abs. Another excellent exercise to help the back and core is bridge exercises or bridge lifts. So to do a bridge lift, you'll lay on your mat with your knees bent and your arms extended beside you. You will then lift your hips up, pressing your glute area up towards the ceiling. And then to do the exercise, you lower your glutes down and then raise them back up. Alternating this exercise. Back and forth. Other simple exercises to strengthen your abs are bicycles. You can do these several different ways, but you can start with your hands behind your head and then bring your opposite elbow to your opposite knee, like this. And then bring the foot back down and alternate sides like this. To increase the difficulty, you can bring your feet consistently off the ground and bring the knees in like this. You can also straighten legs straight up and alternate either the hands to the feet or the elbows to the knees. The final exercise that you can do to strengthen your core is a kettlebell swing. This exercise can be done with a kettlebell, but it can be done with any weight that you have access to, hand weights, even something in your house that you have, like a gallon of milk or something similar of similar weight. So to do the kettlebell swing, you stand with your legs slightly more than hip distance apart, and then bending over or bending your knees, swing the ball back and forward, back and forward. Keeping your knees bent the whole time, engaging your core. You should mainly be using your core. Your arms are doing very little work with the kettlebell swing. The main muscles that are used to swing the kettlebell are your abdominal muscles. The next type of injuries that I'd like to discuss are knee injuries. Most knee injuries are related to weak pelvic girdle muscles, including hip flexors and piriformis, and weak, what we call vastomedialis obliquus, which is the medial head of your quadriceps, this muscle right here. In many people, this is underdeveloped and causes there to be a problem with how the patella tracks. When you have a weak muscle in the middle and tight IT band on the outside, this causes the patella to track to the outside and causes a lot of problems with knee pain. So then we also need to focus on flexibility and stretching of the IT band to prevent knee problems. One of the very simple types of exercises that you can do to help with your development of the vastus medialis obliquus, or I'm going to refer to this this to the VMO from now on, is just seated. Either, you know, you can use an exercise equipment to do this, or you can just do it at home. But to do leg extensions with your foot rotated internally. So when you do the extensions, your foot is pointed towards the middle, and this specifically works this medial area of your quadriceps. If you do a leg extension with your toes straight forward, that works mainly the middle head of the quadriceps. And if you do leg extensions with your toe pointed outwards, it mainly works the outside part of your quadriceps. So what I recommend is that if you're doing these leg extensions, that you alternate doing the position of your foot, meaning that you alternate pointing inwards, straight, and outwards. Then you work all parts of your quadriceps to equally develop, strengthen your quadriceps, instead of doing all of your leg extensions with your toe straight forward like that. And of course, you want to alternate legs, pointing the toe inward on this side. Similarly, you can do squats with your toe position change. So if you do somewhat pigeon-toed squats with your toes pointed inwards, bring your knees down like this, and still with your butt pointing out, like you do a normal squat, then this can help your development of your vastus medialis obliquus as well. If you're doing the exercise like this, versus normal squats where your toes are pointed straight forward and you're going like this. You want to point your toes inward so that it works more of this middle part of your knee. Again, to get the maximum benefit, you'd want to rotate the position of your feet inward, straight, and then outward, more in like a plie type of position to work the outside part of your quadriceps. Area that can greatly affect your knee pain but also causes some hip pain is tight hip flexors. So I'm going to go over some exercises now to stretch your hip flexors. One of my favorite stretches is called the pigeon. It's a yoga related stretch, but it's very effective for working with your hip flexors. This can be done a couple of different ways, so I will demonstrate this first way right here. You'll want to bring your knee flexed out in front of you and keeping your forward foot flexed, and then you'll lean slowly forward over this leg, keeping the other leg extended. You can stay on your forearms or down onto your head or wherever's comfortable for you to stretch. This will stretch not only your glute area, but also your hip flexors. And of course, you'll want to switch sides. Leaning forward slowly to your comfort. Another excellent exercise for your hip flexors it's called Spider-Man or lizard pose sometimes in yoga, but you'll put your one leg in a 90-degree angle, and then you'll bring both of your arms to the inside of that leg. You can leave this opposite knee onto the ground or lift it, but the main thing is to stretch from this position right here. You'll immediately feel the stretch on your hip flexor of the extended leg and the glute area of your bent leg. If you need more of a stretch, you can rotate your foot out to the outside and go down onto your elbows. This will stretch your glute and hip flexors even more. And then you switch sides. Again, the leg is at a 90-degree angle. Your arms are on the inside, and you just simply lean forward, either with the knee still onto the mat or lift it up. And then again, if you want an additional stretch, you can rotate the foot to the outside and then go down onto your forearms. And any stretch that you do, you'll want to hold for at least 10 seconds. Another great hip flexor stretch is butterfly. So you just put your feet together. You can hold onto your ankles and then push your knees out to the side as much as you can. And hold in this position. Finally, you can do a hip flexor stretch from, this is more like a runner's lunge type of stretch. So you'll have your forward leg at a 90-degree angle and your back leg basically at a 90-degree angle too, and you lean forward, continuing to do not hyperextend your leg here, but you'll just lean forward until you feel the stretch onto your hip flexor and glute of the bent leg and the hip flexor of the extended leg. And then you want to switch sides. There are a couple of exercises you can do to stretch your IT band. This is this band of connective tissue that starts at your hip and goes down to your knee. If it's especially tight, it can give a lot of lateral knee pain. So one of the easiest things I do to stretch the IT band is just to cross the legs over and then bend forward, trying to touch your toes. I can't touch my toes quite, but it's just mainly the movement of going down towards your toes. We want to actually keep your legs straight. So the goal of the exercise is not to touch your toes, it's to lean over with straight legs so that it pulls on your IT band and even onto your glute area for stretching that as well. So you want to hold any stretch for at least 10 seconds, and then you would switch to the other side. I can touch my toes on this side. You'll notice that one side probably is different than the other. You can also do a similar exercise against a wall. So by standing next to the wall and crossing the foot over, you can stretch your arm up to the side, and then you don't have to bend over. You can just stretch from this position. Same. Turning the legs over and keeping yourself pinned against the wall. Another thing that I like to do to stretch my IT band is to roll it out with a foam roller. These are pretty readily available, and I highly recommend having a foam roller around because you can use it not only for your IT band, but for a lot of other areas that might need some stretching. So the easiest way to do the IT band is to again kind of lie in that side position with your elbow down and your legs straight out, laying your hip onto the thing and then just sliding forward and back, using your top leg to propel yourself forward and back over the IT band. Putting the foam roller underneath the hip, using the top leg to propel you back and forth over the foam roller. So I mentioned when I was talking about knee injury that there are several aspects to it. The second aspect is actually weak piriform piriformis muscles, which is a deep glute muscle back in here. It can give you buttock pain, but also having a weak piriformis does put more stress onto the knees, therefore promoting injury to the knees. So there are a couple of exercises that you can specifically do to strengthen the piriformis as well. One of the exercises that I like to do is just side walks, and you can do this with no resistance whatsoever, just by getting into a squat position and then side walking like this. This will engage specifically the piriformis muscle. If you would like a little more resistance, you can put a elastic band around your ankles and work against that, never letting the resistance off of your ankles. I use this, which is available in my gym, this stretchy band here. Cross it over, and again, use some resistance against, never letting the tension completely off of the rubber band while I'm walking. This is an excellent exercise to engage the piriformis muscle. The exercise for the piriformis is what we call clamshell exercises. So you'll lay onto your side with your knees bent at a 90-degree angle. You can either put your arm behind your head like this, or lay flat onto your arm with your other arm kind of just resting in front of you. What you'll do is you'll bring your top leg open as far as you can and then close it. You'll right away notice that this engages a completely different part of your glute muscle than you're used to. So just opening and closing the legs like that. And then you would want to switch sides and do it from the other side as well. A similar exercise you can do to help engage the piriformis is to extend both of the legs out. Again, either straight, have your head onto your arm like this, or with your hand behind your head, with your other arm just resting in front of you. And you want to stack your legs completely, and then you will bend the bottom leg to 90 degrees, keeping still the knees in alignment, and then you bring the top leg up and down. This also mainly engages the glute and the piriformis muscle. So doing these leg lifts in this position. It's good to keep your foot flexed during this movement. That transfers the main resistance into the glute muscle. I'm going to demonstrate this from the other side as well. If you have access to an exercise ball, another excellent exercise for your glutes and hamstrings is using the exercise ball in the bridge position. So you put your heels up on top of the exercise ball. Again, your arms are extended. Then you lift your hips up and you move your heels in towards your buttocks. So bring the ball in towards your buttocks like this and extend. Flex your knees and extend. The whole time staying in the raised bridge position with your hips off of the ground. In and extend. Flex and extend. The same exercise can be done without the exercise ball, with one leg out at a time. So you can bring one leg out in the bridge position, or the other one. So if you don't have an exercise ball, you can still do the exercise
by alternating legs.
Next common area that's affected with injuries is the ankles. This also has to do with strengthening, and especially with balance. That can be a major thing to help strengthen the ankles. The ankles are often a weak area. We turn them a lot, and this stretches out the ligaments and makes you more prone to more severe injury. So some simple things that you can do to strengthen your ankles are some balance exercises. That means that you're basically doing an exercise on one foot. So a lot of your common exercises like squats, and that can be done with one foot, and then you are working your ankle stabilizers to help strengthen your ankle. So in this case, I'm doing a modified squat with one leg lifted. This is forcing me to use my ankle stabilizers quite a bit more. If you, and then you'd want to switch to the other side. If you need additional challenge, you can do this on a Bosu ball. I don't have a Bosu ball, but either do it on the round side or the flat side. Anytime you have to do additional balancing, you'll strengthen the ankles even more. Another exercise that is helpful for stabilizing the ankles, just because it's balance, is a leg extension with one and a knee bend. So you're just having one leg extended and your knee is bent, trying to stay balanced. Works your ankle and strengthens those ankle muscles. And you switch sides. The leg extended. Well, thank you for your attention today. I hope that you have learned something and you will use these exercises to help prevent low back, knee, and ankle injuries for you, especially with the institution of our new combat fitness test. You'll want to make sure that you have addressed weak areas so that you can avoid injury. Have a great Army Day.